This podcast is for informational and educational purposes only.
What is up, everybody on YouTube? I'm here with my buddy Josh with another episode from, actually, this isn't Coach's Corner. This is going to be a little different today. I'm going to be doing a little educational services.
Medical sidebar.
Medical sidebars, correct. But we wanted to talk about, Josh has done a great job putting together a little bit of a kind of, I don't want to call it a user's guide for Trenbolone, but what he calls a practitioner's guide to Trenbolone and user health monitoring. Josh put together like a nice write-up on going over Trenbolone, and if we're going to incorporate that into our stack, how to use it with a little bit more wisdom and a little bit of educated approach to how to use Trenbolone, how to look out for different side effects, how to mitigate issues that might come your way. We're going to also explain a little bit into what makes Trenbolone kind of the monster it's become today, what makes it a little bit more something I feel needs to be probably respected in its use a little bit more than we would something like testosterone or something like a different anabolic that we would typically use, the DHTs of the world, and the other 19 NORs are quite not as powerful, in my opinion, as Tren.
Tren has got to be the strongest steroid you can inject without a bunch of chemicals. You know what I mean?
Correct. And it comes with a litany list of side effects that make it a little bit unique that we want to go over so people can probably just do them, as Josh and I say, a more responsible way of abusing their compounds.
Yeah.
Realistically.
You love Tren. I love Tren. We all want to up the trend, but we probably shouldn't.
Yeah. The thing is, too, is in reality with bodybuilding, Josh, there's definitely the places that Tren fit in these preparations for show prep. And sometimes there's applications to be using it at the end of a bulk when we might be transitioning before a health phase using a little bit of Tren because we want to recomp the body.
Just the irony of like before the health phase we'll use Tren. I understand. No, that's what I'm saying. I'm very realistic on the use of steroids. I completely understand there's going to be the guys that are like 30-day Trenbolone studies, or that was a big thing on TikTok. And obviously if you're trying to be a professional bodybuilder and you're not going to be natural, then this is probably going to be in one of your needles.
Right.
What I'm looking at is, hey, this is what a medical provider would do. This is how intense it would be to monitor this stuff medically and try to keep you harm reduction level down. And you'll basically just see what they do and what we would do, and how sometimes even if you do it all right, it doesn't matter. You still just lost your kidneys because you like Tren too much.
Sure. Yeah. So that's our goal, is to teach. Yeah, you said it perfectly. You have a more thorough medical approach to monitoring your use of Trenbolone.
Yeah, the other thing is, I am a registered nurse. I'm not one of those people that calls himself doctor and doesn't have an MD or has a PhD and like other stuff. So just wanted to put that out there.
Yeah, Josh, you got a good outlook on how these things should be looked at in the medical field as well. So let's pull it up and we'll just sort through it. I think maybe if you don't mind, Josh, if you want to just give us a kind of a rundown from your opinion while we pull up your guide.
Yeah. The big thing about Trenbolone
makes Tren a little bit unique, if we could.
Neuropsychiatric problems are top. It's top effect. And it needs to be monitored immediately and quickly and readily. So in the guide, in your appendix A, you'll have the questionnaires you'd ask and what kind of mental health thoughts come through as you do Tren. Are they bad thoughts, good thoughts, suicide thoughts, things like this? Obviously, with suicide thoughts, you need to stop Tren and see immediate medical help.
Yeah, exactly. Yeah, that's one thing that Tren's notorious for, is it definitely has a big impact on your brain. It's, I believe, from what we've always been taught, is neurotoxic itself, or believed to be neurotoxic, which is unique from some of the other compounds that we play with in the hormone world.
What I've seen is your 19 NORs all impact all of your neurotransmitters, all of them, and sometimes reduce your ability to make them.
Yeah,
and then there's all kinds of stuff you can find on Tren for your brain. But the main thing is, how is your brain reacting to the Tren? Is the first question.
Exactly. Is this what you have on chapter 7 here?
Yeah,
Psychiatric?
neuropsychiatric. Yeah.
Okay.
And
We'll
like I said,
skim through that after.
yeah, that's fine. Right now, the guide's is always looking for feedback. Joshua Kevin Perry at protonmail.com, and Dave will put up the link for the thing. Read it, let me know what you think. I'm going to add a GI section just for basic stuff. It's not that big a deal. And then nutritional stuff is a big thing I don't have too much on because I don't generally have problems.
Now, what else, Josh, would you say, other than the neurological aspects that come along with Tren and the side effects, what else makes it unique?
Well,
we understand that it's one of the stronger compounds that you can take, period.
Guaranteed to damage organs. When you're using it on cattle, you don't really care about their organs because they don't have long. Nephrotoxicity, so you need your Cystatin C. I recommend a urinary ACR. A urinary ACR will basically tell you if your kidneys have blown open and they're spilling out your albumin. When that's happening, you're heading towards dialysis very quickly.
Correct.
Or dying. Cystatin C is always going to be the one to get. The Cystatin C EGFR. There's information on there how to combo your creatinine plus, but your basic thing is red flags and how to manage everything that happens is in this book.
Let me find it. You have a good list here of what things can be looked at pre-cycle. Is that this right here? Yeah, pre-cycle baseline. So when we look at monitoring our health panel through our blood work, these are some things that Josh here suggests that would be good, as we talked about before, getting a baseline and understanding where you are at with your health and some of these numbers and having a starting number to reference. It's something people forget. They usually go ahead and start their cycle, they start their fitness journey, never really think to get a kind of a baseline of where am I at before I introduce these compounds, fat burners, or all different things that you're going to play with between GLPs or whatever is really on the list for your fitness journey. So this is really cool that we have this put together, that Josh was able to put this together. So you want to give me the 2-cent tour on why you're picking these things here for your baseline blood work? There's a lot of it's the basic stuff. I mean, a lot of it we're going to want to see.
Yeah, it's all this, most of this stuff is stuff you're going to get anyway. Your CMP, your CVs, whatever. Looking at the only ones that probably stand out, urinary ACR. I don't ever hear anybody talk about that when they talk about standard use model.
Can you explain roughly what we're getting out of that? The urinary ACR.
Urinary ACR. Okay, so albumin sits inside your kidneys, your nephrons, and it basically keeps your body from spilling protein out into your urine. So if you have a urinalysis, you get a protein urine, you have protein coming out. Anyway, what this one will tell you is how much is coming out. And if you're over 30, you started getting some damage. If you're over 300, your albumin is starting to come out too much and you're in all kinds of damage. It's called macroalbuminuria. That one you need to be at a nephrologist's office. Okay. And they're going to get, like I said, that's in the book as well. But they're going to basically say, hey, you get 80 grams of protein a day. Hey, your blood pressure can't go over this. You're in trouble.
So that's a good marker of also like kidney damage and liver damage. Is that
right? Cystatin C down 20% is a big marker. Granted, I have seen people recover some of these markers, and that's ideally you can, but there is certainly a tipping point where it's,
No, that's a good one. That's a good one to point out of what this is actually getting for us. And then a lot of these things, like this one points out to me, ECGs and echocardiograms.
Yeah, so a lot of people can't get those offhand, so that's why.
It's not always the easiest to get your hands on the capabilities to run these, but if you can, that'd be a great way. That'd be one of the coolest things to see baseline is actually get imaging of your kind of rough imaging of the heart before you even jump on any of these compounds. So this gives you a good idea of things that we'd want to check. A lot of them are going to be very common to things we'd already be checking on a hormone on a bodybuilder's blood panel.
Yeah,
anyways.
Yes, do very good.
Yeah. So getting this covered, getting a basic understanding of where you start with your health is going to be important, as well as probably like a general baseline of mental health. Understand where you're at mentally too, because there are some effects. Everyone talks about Tren. The demons of Tren come out when you're on a diet and a calorie deficit, and I can definitely attest to that versus off season.
Demon in a bottle.
Yeah, you seem to be.
We got nicknames for it. All right, hang on. Anabolic ayahuasca, demon in a bottle, divorce in a bottle.
Divorce in a bottle.
All right. We got any more trend jokes? They're legion. I'm happy to hear more. Send me trend jokes if you have trend jokes.
There we go. We can zoom in a little bit. Perfect. Yeah, fuck, now I forget what I was saying there. Anyhow, gives us a good idea of what we should be checking before.
Mhm.
On cycle monitoring. Now, Josh, you did a pretty cool job about actually breaking down through chunks of time here as we kind of look at our cycle of how we'd be looking to monitor our
Oh,
blood
yeah.
work. So we're looking at 4 to 6 weeks. Josh is
Mhm.
suggesting these things, and
Yes,
I'm in
and that
I'm
is
in
a
agreement with
that's
all
a
of it,
standard
yeah.
I did run for myself when I was the N+1 experiment for this.
Yep. Yep, getting a good idea of EGFR and how that's continuing at 4 to 6 weeks would be a good time to check that. We're always going to be monitoring blood pressure consistently at home. It's something people say they do and don't do. So if
Right.
people don't have a blood pressure monitor, it's one of the easiest things to just check red flags. When we talk about red flags towards our health, a lot of things can be caught with blood pressure itself. And then you can just quickly find out from there what seems to be the issue and at least address the blood pressure issue pretty quickly through medication or change in diet or change in really however the problem arose.
Up the stairs.
Yes, cardio, maybe that's been missing for a while, things like that. You think it's worth you touch on that for a sec, Josh? What kind of that's another thing worth talking about. What things would we want to have in place for like
For cardio?
our daily habits, looking at
Okay.
everything. I mean,
Your
things
regular habits, your regular medical recommendation is 150 minutes of cardio a week. That's regular walking. Enough to talk, not enough to sing. Don't be out of breath or sprinting for about half that time. For your HCl management, double that and add 2 sessions of HIIT. With that setup and 600 milligrams of Tren a week, I was able to run an HCl of 44.
wow,
Now,
that's really
I
good.
can run more than most people can because I'm a crazy person. And the Tren helps. See, Tren takes it away for a little bit, but then it gives it back to you because you're insane.
This is true. Is
At least
there
for
any
like your intensity.
any dietary things you would suggest with Trenbolone versus anything else? I honestly can't think of anything dietarily.
Honestly, I say go hard on the red meat and just dig right into it. 96 lean, just as lean as you can get it. And just get as much out of this as you can because you don't want to do this very often.
Yeah, that's a good point. And say we're using this for a growing scenario.
Right, yeah. Growing scenario for sure.
Yeah, there's not to be had if we're going to monitor ourselves to this extent. You might as well make most out of it. Push your boundaries then. I'm not going to suggest that to people, but
no,
I think paying attention to
so many years by powerlifters to grow. So it's not
Sure.
unheard of.
Sure.
That's the thing. I want other people to use this too. It's just
we've seen many times with different scenarios people using this a little longer than I would suggest, and I'm not the judge of truth.
Yeah, no, I understand. No, my thing is this is your body, this is your choice.
Yep, absolutely. But I think that's a good point. Things like even off-season scenarios to be a little cardio protective and also to help just about every other aspect that we'd want as a baseline health metric. Just inserting cardio is going to make a big difference. Like you say, managing LDLs and
every 10 minutes extra of cardio per day tends to raise your HCl by like 1 or 2 points. And that's a big jump.
Yeah. And then baseline things that I would harp on anyone for anything would be have your diet in line and have a good guided plan. So when you go to jump into these cycles, not only are you monitoring your health responsibly, but you have a good plan of where I'm going with this. And like you say, Josh, making the most.
Please have a coach
out of your time. Please, yeah.
Please have a coach. Yeah. I expect most people to do it because the whole thing about bodybuilding is it's very cheap or very expensive.
Yeah.
But the coach would be the best one, or at least a partner that pays attention to you.
Yeah, that too. Yeah. People always say too that coaching is expensive. You know what's expensive? Having no guidance and buying every health supplement you don't need when coaching.
Every $100 a month you spend on a coach saves you about $1,000 of work.
Yeah, I'd say
I can tell you that because I've done the work. It's because you basically make yourself a coach. Sorry. What's up?
No, bro. This isn't going to be on everybody's radar of what these things are and what they are, especially like to be honest, high sensitivity troponin.
Yeah, those are tests you can
why are we looking at these?
Troponin is your heart attack. Yeah.
Oh, I understand. I'm asking you to explain to them.
Well, this is stuff that you're not able to get most likely from your like Ulta Labs or your Algo RX or all those other places. I can't really read it on your screen, and we don't have it right line up here for us.
But lactase dehydrogenase.
Oh, the LDH is something it's just a general marker. They do have an isoenzymes version that will tell you like where the damage is occurring, like kidneys, heart, liver.
Sure.
So most people can only get LDH, but the ISO is a lot better. And if you're going to do Tren, you're going to want to be an ISO. The thing about the ISO is it also tell you how much damage your statins are doing to you.
Oh, yeah, that's a good point.
Because that's the one you would check. Wouldn't you really want to know what's going on with the statins on your ability to take them? Because with Trenbolone, the only thing for your LDL, if your other measures aren't working, is to start ezetimibe and a statin.
Correct.
Medically.
Now, if we can get an ECG again, that would be a good time to execute that, maybe the 8-week mark.
Yeah, if you're one of these people that's like way up there in wealth and wants to have everything done perfectly, find a doctor that'll run this for you. But if you're somebody who's bare bones and stuff, and I was like, then always get an ApoB, always get a statin C on this, and a CBCMP. You're going to need those for sure. Big 4.
Would you be able to give people a rough idea too? Because this is another one, right? We talk about uniqueness of Trenbolone.
Oh, the prolactin stuff.
Monitoring our prolactin too, right?
That's prolactin.
Want to be aware of a bit more.
All right. Main thing about prolactin is: are you getting the side effects for prolactin? Okay, then your best option isn't Caber, even though the internet will tell you to take Caber. Your safest option is going to be P5P or any version of B6. 50 milligrams a day of P5P. I don't know the B6s exactly. Or 100 milligrams every other day. The big thing that people have with prolactin being high is they can't orgasm, which is both good and bad.
Right.
So if you can't orgasm, safe to say you have prolactin high. If you go test it, like obviously if you're in medical stuff, you're going to be tested. But if not, that's your first step.
Is it fair to say, which I would say is some people are going to confuse prolactin side effects for estrogen side effects mistakenly. A lot of the times when you have erectile issues, or you start to have some of these sex.
Tren is the one that can give you tits, gives you breasts basically, without having any estradiol in the system.
Through prolactin.
Right, through prolactin now, which is the same treatment. But you could also have some estrogen sitting around that's messing with you too. So most people have a testosterone base that gives them their estradiol. Parabolic runs stuff. He ran a bunch of estradiol and just Tren runs, just a cattle, and it worked out for his physical body for sure. But I don't know. I think that's be even worse to try. But he might have stuff that works, and he's got a system.
Yeah, most people aren't going to be worrying about doing that themselves. Yeah. That's more of an interesting side.
Right. There's all this side. Right.
But
Tren
but it's worth mentioning.
Yeah.
But it's worth mentioning some of the side effects you might experience from prolactin could easily be mistaken right off the bat for estrogen elevation. So I think being aware with us explaining and people just being a little more aware of 19 NORs, but Tren specifically as well, when those problems arise, if they do, getting prolactin specifically tested and hopefully you have a baseline of that as well, is going to quickly differentiate between prolactin or estrogen problems, and then you can alleviate the problems from there. So it's worth people understanding that.
Oh, and a sensitive estradiol test is the other one. You got to get that one. Yeah, ultra sensitive, because Tren does show up as estradiol.
That's true. So we can explain that too. So this is another reason why we get ultra sensitive E2s is not just by the accuracy of the range of the scale of what we're looking. Like, ultra sensitive E2 does a good job of really showing the numbers on the low end in an accurate fashion of estrogen, and also where Trenbolone can false flag E2 or estrogen scores. Getting the ultra sensitive is one kind of form of protection to make sure we're actually getting an accurate estrogen reading while we're using Tren. So that's a good point there. Now the other stuff's pretty obvious, like annually, echocardiograms, ECG. So we pretty much have you did a great job having a thorough layout of a game plan of how we're going to monitor health pre, during, and post cycle. Am I missing anything, Josh, that kind of you'd want to hit on that?
Let's see. We've got our guides. There's like a medications page, tells you everything to get, but it's stuff.
But before I move on to post cycle monitoring, like blood panel stuff, is there anything worth?
For the most part, if you're taking Tren, you're going to be on TRT for the rest of your life. But This tells you everything it's going to do to you.
This one's good. Right off the top, right here, expected cardiovascular lipid profiles patterns.
Same as every steroid.
I hate to put you on the spot for everyone, but do you want to roughly explain why HDL is going to, what to expect with HDL, LDL when we look at lipids? I feel this is something people don't look at.
Good. I did run into this one during my experiment. But what you got is you increase your hepatic lipase when you start taking anabolic steroids. So your HDL3 becomes HDL2, which is a worse version of HDL and doesn't clean as well. So what you're looking at is anytime you're on steroids, your LDL is going to go up, which will increase your damage to all of your organs. So HDL goes down, LDL goes up, more organ damage. So if you're not keeping your HDL into the range, then you're in trouble. And if you're and you see your little list on stuff, but like I said, simplify it. If your ApoB is high, you need to stop what you're doing steroid wise. Probably initiate a statin. Definitely diet needs to be looked at. Definitely cardio needs to go up. There's a lot of interesting. Yeah, go ahead.
How quick would you be looking at these things for? I know you put in your blood work post-cycle, pre-cycle, and mid-cycle, but how quickly should people be checking their lipids on Trenbolone when it comes to their blood work? Probably every time they go in, maybe every 6 to 8 weeks.
Yeah, ideally, your Trenbolone cycles are not like your 24-week cycles, but every 6 weeks for sure.
Yeah. Yeah, that's a good point. Now, when you developed this, you were thinking pretty much, let's say, like a 12-week maximum scenario, or what did you have in mind?
Yeah, I did 16. Yeah, 12, whatever cycles you guys want to walk. There's different cycles listed in there and different rates and stuff, but however long you people are going to use it is how long this is the medical guide for it. Now, as your stuff goes down and down, you're running into more and more problems, and there's less and less risk of chance of pulling you out of it. But like you said, everything right there. And then if you want to do ApoB instead of LDL, that's on there as well.
I always find pulling everything I can.
I like to get everything I can, but like I said, I look at bodybuilding as there's a lot of broke people that do it, and there's a lot of extremely wealthy people that do it.
Yeah, no, that's a good point. A basic lipid panel, and then maybe ApoB individually.
And I do like daily NAC with this drug because it can be hepatotoxic as well, which is very unique for an injectable. Certainly.
Yeah, you got a rough idea of why that happens, how that works with Trenbolone having hepatotoxic be so prevalent compared to other things?
How it's doing it, I'm not sure. That I don't have. I haven't gone to the biochemistry level on all of these things. It's just, what is it doing medically? What is it doing biologically? And then here we go. So for whatever reason, it gets up your ALT, AST, and your GGT, which means it's impacting the cholesterol system of your liver and your other part of your liver. Yeah. Basically, liver is read off on our scale that tells you which part of the liver is being messed with, hepatic side or a cholesterol side, or I can't know what they call it.
I wonder if it's worth theorizing that just like the aggressiveness that Trenbolone can change your cholesterol and triglycerides affect the liver directly, just because that's where we're producing a lot of our triglycerides through the liver. Yeah. Is that so? Maybe just a kind of an overload of the system.
Yeah, because I'm not sure. I think I don't know where the triglycerides are made. I know you can absorb them through the diet. I know the LDLs, HDLs, and all the cholesterols are made there.
Okay.
It's kind of like well,
you know what we ought to do someday is blood work we should do a blood work.
We should get a cow. We should get a cow and give it Tren. And then like
I wasn't going there, Josh.
Look, man, listen, I feel like a guy like you knows how to get a cow. And you have a place that you can put a cow, right? You know what I'm saying?
I can get one alive. I can get one dead. I can get one.
We want a living one that we can. We want you to get a cow in a bathtub. We can make his Tren. You know what I'm saying?
Yes.
Let's complete the meme.
We'll figure out what to do with the pellets. Yes. Yeah. No, I was saying do blood work on a budget. Like we should do two things. You can dress up as like a millionaire. I'll dress up as a hobo, and we're gonna see your blood work receipts, and then we're gonna see mine and see if we can cover all bases on a budget.
No, I can tell you that right now. I've already figured it out. Look, CBC, CMP, A1C, Cystatin C.
What are you missing? CBC, say again, CBC, CMP, that's cheap. A1C, cheap. Cystatin C.
It's expensive. And ApoB. And if you want, you can add a GGT. But if
I was going to say a little further on the kidney would be worth it.
We got Cystatin C. What else?
Yeah.
Urinary ACR. I'm doing the cheap way. We got to be cheap.
Yeah. GGT would be good. I mean, we're going to see AST and ALT in our CMPs, but a little further with
you can use the GGT or you can look up the R values for kidneys, and you can figure out if you need to look at a GGT. But it's just one of those things. I think it's like a $7 or $8 test. So add the GGT, and then you've got your liver, you've got your kidneys, you've got your heart, 3 blood work as far as that goes.
Yep.
Everything that you can check, because your brain is going to be questionnaires and yourself. Oh, sleep is a very big one on Tren too.
Yeah, let's circle back on that, because I'd like to give people after some thoughts on how to maybe alleviate that, Josh. I'm sure you got some ideas on how to remedy that. But this here's a great also indicator. I'd agree fully on this, is that the second we're getting below 25 milligrams per deciliter on our HDL values, that's the hard stop, where I'd be trying, I'd be at least addressing with people, how can we fix this before it drops any lower.
Oh, absolutely.
So you put together and what to expect for action and risk. Pretty cool. Sorry, I'm
you're fine.
absorbing this as
the hard stop. I ran into the 22. I'm basically, when I did the Tren plus the Anadrol, it cut my HDL in half to 22, and that's why I was like, no more Anadrol. I'm good.
Yeah. The orals always do that. It's funny. Everybody gets, it's like, it's a race to see who can handle orals the less. There's
a race to the bottom.
There's no, what do they call it? Hypertolerators. I don't find any hypertolerators in the oral steroid verse of things.
There are a lot of kids that take Anadrol and they're fine. It's strange.
Yeah. But
like
that's
daily Anadrol. I'm like,
but that's because they're what? They're kids.
Right. Yeah, whatever, man. The best livers ever.
Yeah. So when we look at the renal aspects of things and we move away from cholesterol, just renal guidance, is there anything specific to Tren? Because we're going to be looking at things like you have in here. We're going to be checking kidneys.
HDR
and liver.
is the one that's going to jump out at people because they probably don't get it.
Yeah. Again, do you mind elaborating on why we'd want to take a look at that?
Just albumin sits inside of your kidney nephrons, basically keeps you from peeing out all of your protein. As that number goes up, your albumin starts coming through, and so does all of your protein. So basically, big problem for you there.
Yeah.
Your kidneys are basically dying.
It's showing poor filtration as well, correct?
No filtration at the 300 level.
Let me see here. Dave's going to try a magic trick and have his mouse get charged while I use the keypad.
Oh,
all right. Yeah, a lot of the renal things too. Yeah, so kidney values, just keeping a good eye on that is going to be through our basic, everything from CMPs to CBC, and checking on GGTs, and EGFR would probably be a good cover of renal functions in general, very thoroughly.
Yeah, and I do love Cystatin C, because when I was going through, as a hemodialysis nurse, when I was going through looking for bodybuilding people that knew what they were talking about, the ones that actually brought up the Cystatin C, I was like, oh, they know at least something. And they're aware of a blood test that we all use. Oh, the hematocrit. Oh, what do you mean? In the bodybuilding space, there's a lot of people that say they have information and pretend to be like, have information that's great. And if they don't have basic stuff like what kind of blood work you should get, they're the people to avoid.
Yeah.
Or if they're people that, like, obviously the people that pretend to be not on steroids and are pretty bad.
No, a lot of these guys are going to be familiar with the hematologic parameters, as you write in here, for everything from hematocrit to hemoglobin. Does Tren act any differently, let's say, than other compounds? I know EQ and the DHBs of the world are going to have their own reaction to blood viscosity, but what do you think with Tren? I've never really seen it be massively worse than even.
No, I haven't seen anybody blow up their hematocrit with Tren. Specifically.
Yeah, like we would expect with some other things like EQ. Some people just tend to have to keep a little better eye on those things, but it's worth checking. You're going to be taking a look at that in your CMP and CBC. Where do they put hematocrit? That's CBC?
Yeah, the complete blood count.
Yep. What's your cutoff? I'm literally like, if it's 55, the second I see 55 is where I pump the brakes and stop everything. I'm not afraid to let it rise a little bit. I want to make sure that hematocrit's something that we also make sure people are screening properly. How many times have we seen guys be completely dehydrated? They say, "Oh, it's fast blood work."
Best thing to do when you go to bed at night, weigh yourself. When you wake up, weigh yourself. That's how much water you breathed out.
Great point. I've never heard of that one.
Yeah,
I've actually literally never fucking thought of that one.
I do a lot of trach and vent kids, and that's one of those things where
And you'd want to replace that weight back in water before blood work, correct? Is that what you're getting to?
Yeah, replace that, and then you have a general idea of what your blood looks like.
Okay.
You know,
Yeah, people. Josh just gave you a foolproof way to make sure. That's pretty good, Josh. I didn't even think of that. I'm going to use that every time now. How can we get your blood work when it comes to hydration?
I mean, if you guys like to do something I call skull fucking the details. So if you're going to skull fuck the details, here's some medical details that I use to write you.
So hit it again. I go to bed at 198. I go to bed at 200. I wake up at 198. What am I doing to
2 pounds of water to drink?
Okay. You got it. So it's 216 ounce bottles down, and that's close enough. And we want to have a form of consistency with hydration when we're looking at blood viscosities and we're comparing numbers to numbers on blood panels from month to month.
Preferably, you're not donating your Tren blood. You're actually getting a therapeutic phlebotomy, but I understand.
But Josh will take it.
No, there's Tren in the. Don't give Grandma Tren. Please.
Josh will take it, though. You never know.
But to be serious, we don't know how harmful these drugs are to fetuses because the company that made Trenbolone did not release the information. Now, the blood is filtered severely. Do I know for sure it gets all the Tren out? I don't know. There's no way for me to know.
When it's able to make it past the brain barrier, I'm sure it can stick around, let's say, in blood. Endocrine profile. What's again? I'm not going to make you go over everything.
The endocrine stuff is not really a big deal because to be realistic, you can recover your stuff after Trenbolone, but the people that are on Trenbolone are probably just going to go right to TRT and just relax.
Sure. Now, would it be fair to probably say just the prolactin and estradiol management is probably going to be your number one endocrine thing that you're going to be managing from quickly?
Right. If you were doing Tren as your second compound, because that's all you can take. Oh, preferably you don't take it. You take just test and GH or whatever. But if Tren's your second compound, you just keep your TRT or whatever it's at. Should not have too many side effects estradiol wise from the Tren. Tren shouldn't impact your estradiol.
But we should probably mention you're going to expect the similar outcomes to other androgen compounds. So shutting down natural testosterone production, that happens with Tren just like any other compound, even testosterone itself. What about
it tends to bounce around in the system because your body doesn't know how to break it down so well. So when you're off Tren, you're still gonna have some Tren, and then I want to say you can be tested positive for it for years. So if you were thinking about being a natural athlete, you've gone too far already.
Yeah. Now, what about you put in T3 here with metabolism and for thyroid thoughts?
That's what I was saying. Tren goes different ways on that. So it basically seems like it runs out your T4 with people usually go with GH as well, but run out your T4, maybe T3 goes up, down. Basically, just look at everything. You're going to do a whole other thing on that.
And I'm hoping to think people are checking their TSH and their thyroid value.
You should have a full thyroid panel for sure if you can afford it. And they're not that bad either. And maybe we should add that to the hobo's guide. That's what I try to think about when I'm talking about stuff. I'm trying to think of the lowest level of income or the most easy thing to access. Like when you guys talk about L-glutathione shots, they're great. And you can probably get an IV. But my friend can go down to Walmart 4 minutes away and he's got NIC.
Yep. No, good point. Luckily,
it's good to know what the best is, and then it's good to know what you can actually get that is in your.
Luckily, a lot of the places I work with, they continue to break down thyroid. I forget the place that we used to get blood work from. It's on the tip of my tongue, but you could only buy TSH with free T3 and free T4 as a package, and then I had to buy reverse T3, T4.
That's standard. Reverse T3, reverse T4, 3 or 4 are not generally looked at medically. I don't even know if reverse T4 exists. But if you have like high reverse T3, isn't the only treatment to just take more T3? Or is there another treatment? Correct. You know what I mean?
For the most part, that's what they're going to do. But the nice thing is, I believe Alta Labs now allows me just to pull T3 levels. So like you can get nitty gritty with it if you want.
Yeah, I use
the way I was going to get into it. It's not really it's not a massively expensive thing from TSH to get in a full idea of your individual T3 and T4 levels.
Yeah, I recommend that for everyone, even if you're not going to use any gear, because TSH have problems. Thyroid problems are common in 80% of women.
Yeah.
Not as much in men, but 80% of women.
Yep. I've seen that on my end. quite a bit with women. You got to be a little. Luckily, they're not going to be running Tren on if I'm coaching them.
Hey,
But of course-
listen, if there are women with Trenbolone experiences, I would love to hear them.
Yeah, I would too. I'm trying to
But,
think if I can even think of anybody on podcast.
That's what I'm saying. I don't think I've ever heard of. I've heard of some
think
women,
Paul-
doing it, but not that stick out.
I think Paul had a women's bodybuilder competitor that talked about it in her past. They've done it, of course. It's just not as common. Yeah.
It is quite strong.
Okay. All right. Let's move along. Can I get you to reiterate this one of prolactin and how they're looking at
If
their
you're using
their
blood
numbers?
work for your prolactin, that's what you got, and it's basically the medical professionals are going to try to give you cabergoline. I don't like cabergoline because of heart scarring. I don't like Clem because of heart scarring. I really don't like steroids, obviously, because of heart scarring. The less you can do to yourself, the better. But that's why the P5P is in there and not cabergoline 0.25 or some of the crap.
Well, what about the dangers? Do you think there's some legitimate dangers with the dopamine reactions with Caber? You overuse it in general, you're going to be running into a little bit of a neurological issue with kind of how you take in and out dopamine and
there's a million things you can take that will mess with your dopamine. There's a million things you take that will mess with your serotonin. There's a million things that mess with your GABA, including GABA itself, which is available over the counter. It's like there's a million risks of everything, and that's why if you're using this guide, you have someone helping you.
Yeah, I think it's fair too to mention that some guys, they don't realize that Caber is not just like it's not like the AI for prolactin. It's not really doing the same kind of scenario. It's where it's not very benign. There is some issues with Caber. It messes with your brain. That's the purpose of it. That's how it works. And some people just have some pretty nasty side effects after, and never quite the same mentally, let's just say, from overusing, especially young developing brains. Because what used to be on the forums, dude, just two things used to be testing an AI was common and standard, which I'm not against. There's nothing wrong with that.
They started out with the AI everyday thing, and then
Sure.
but
it was standard practice that you're going to run an AI prophylactically almost, and keep an eye on your estrogen down the road. That was standard practice with testing AIs. But you could also say we would commonly see in these forums a lot of preaching of Tren and Caber, just no thoughts to it. It just Tren goes with Caber. And I don't think people want to do that.
They're thinking Tren and Caber is a good combo. That's a terrible combo. Tren and P5P, Tren and going to sleep.
And you do the same thing, Josh. Like, you wouldn't be just taking P5P prophylactically. You'd be looking for these nanogram per milliliter ranges of your prolactin before you insert it.
Well, I get I can tell when I have it because I have anorgasmia.
Okay.
So I just know I need to take some P5P, and I had a high prolactin normally, I think.
And what is that? Is that difficulty climaxing?
Yeah, I could have sex for 18 to 25 hours.
But yeah, some guys run into kind of like the whiskey D, kind of just like you could go, but you can't climax.
Oh, I wonder what that was.
Yeah, you ever had a whiskey dick back in the day?
No, I had cocaine dick once. I was mad. This girl brought, this is a long time ago. This girl brought cocaine to my house. I was like, how dare you bring cocaine to my house? So I just did all her cocaine. I was mad at her. And then I was like,
how dare you? It's a magic trick. Now you see it, now you don't.
Like, why would I do cocaine? Stupid.
Yeah, I don't like cocaine either. I just like the way it smells.
The smell is, I just needed to learn the metric system so I could be a machinist.
Yes, the machine. That's a great movie.
Oh, well, no, I was a machinist. Yeah.
Did you really do CNC work?
Yeah, I was called circles.
Were you like a night owl? Were you one of those working the third shift?
CNC? At my factory, it was 6 days a week, and my shift was 2 p.m. to 3 a.m. or 2 p.m. to 2 a.m. And you got a 30-minute lunch. It was awesome though, because they would, what is it called? Oh shit. Torch. They would weld stuff while you're walking around. They just putting wires together for you and stuff, and you just spin into your machines. But yeah, it's just. Yeah.
I've done so many different jobs over the years, and I used to work on a CNC machine place where my job was cleaning a lot of cleaning a lot of the machines. Basically was my job. I pretty much would make it easy for people to operate them. I'd clean them pre and post. That's their use. Yeah. One job, I never learned a damn thing. I used to not mind doing crappy jobs just so I'd learn something different. You can take something away from any job, washing dishes, I learned how a kitchen was run. But for CNC stuff, I didn't fucking pick up any info. Other than metal,
like these days, just get a 3D printer for whatever you need. Like I have people that print blocks for their bed and stuff like that, and just awesome crap. And Warhammer minis too, I'm sure.
All right, so I keep distracting myself. I don't think there's anything quite uniquely different we got to look at when it comes to glucose management.
We're still looking at the human body. It's still the human body, and it's still just what medically is appropriate for the human body to look at.
Yeah, I'd say there's no different song and dance with keeping an eye on glucose versus tren versus not using tren on cycles. So that's something you're going to want to pay attention to anyhow. And then what about, like you wrote, the hepatic functions? We've talked about keeping an eye on getting a urine analysis, but obviously you're still going to want to keep an eye on AST and ALT and just see if there's any crazy deviation.
And discuss on that management thresholds. Those are your limits, and then use those to find your R values for your kidney, figure out what's messed up. But how much do you want to look and learn? You can learn pretty much everything through this document. If you just want to send it to your coach, you're like, do this, that's fine. Probably take out stuff based on your budget, but that was the only thing I didn't really put in there, like how to budget for this.
That's maybe an add-in. You could add that in down the road.
And like I said,
I don't think it's crazy more expensive other than what you're going to pay for imaging if you're able to get it down the road.
Right. Oh, and that's a good one you got pulled up there for blood pressure, because that's your standard operating procedure for intense blood pressure. ARB or an ACI, calcium channel blocker, low dose thiazide diuretic.
What are you a fan of? Are you more of an ARB person? They always done better with me than
ARBs are too strong. I can handle.
Oh, really?
Yeah. At this point, at this weight, I don't require.
Yeah, I guess you're right. Yeah, I mean, you've probably done some experimenting with blood pressure management.
Oh yeah. Okay, so my initial stack, my initial cycle was telmisartan 80 and chlorthalidone 50. At this point, the most I could ever take was chlorthalidone 25, and that's the one that's 24 hours of hydrochlorothiazide. So it leaks out what you need it to leak out.
Sure.
I don't really get to the bath having to wake up at night pee thing that most people do. I do drink a lot of caffeine and water.
I'm not as bad as I used to be. Maybe once for sure. I'm getting up twice, maybe just to stretch and take a leak.
Yeah, and that's the thing. It's like you can start an alpha blocker and just get it all out the way.
Tanya made a good point when we talked on Paul's the other day about really starting to think about approaching hydration just through the electrolyte standpoint first, because that's going to be a huge it's not easy to see the variations in hydration through electrolytes if you're not tracking them as much as you're going to see through water consumption. Does that make sense? So it's probably wise to make sure you have some forms of consistencies with water retention through your electrolyte when you're keeping an eye on blood pressure too. I think that's because people get false readings and they insert chronically using even just 12.5 hydrochlorothiazide might not be something you want to be on all the time.
Like I said, if you can be on nothing, if you can just be on the treadmill like I do, you could just be on the treadmill. But you guys are going to get, like I said, bodybuilders are going to get bigger and bigger, and at a certain point you're not going to be able to run. Like I think once you hit 220, 230, running becomes a real pain and a real
it might be counterproductive to what you're doing too.
If you're trying to grow muscle, but if you're trying to run faster, going higher than 230 is probably more than you want.
Yeah, most guys, you can set them up on the bike and get what we need cardiovascular out of them and probably not take too much from other factors. I'm not going to go too much because we did hit on a little bit on lifestyle, and that's going to pertain to blood pressure and lipid management. But again, Josh always makes a good point of some of these easy foundational things in health, whether it's Trenbolone cycles, testosterone cycles, or natural cycles, is going to be having some form of baseline of cardiovascular, having control of your diet so we can that's an easy low-hanging fruit for lipid management, is just making sure we can first and foremost audit what's going in our mouth.
A blue-collar fundamental.
Yeah. How many things could you probably save money on and address for health problems?
No one would need a doctor if we ate properly and exercised properly. Almost.
Yeah.
You know what I mean?
Other than maybe a broken bone, and there's going to be a few things that's going to be.
Yeah, but I was saying like emergencies and stuff. But no, it's our number 1 and number 2 killers are lifestyle-related diseases, cancer because of an inflamed state.
Your thought on omega-3 fatty acids? I swear to God, everyone's got a different daily amount. What do you think?
Okay. My opinion is this: if you can get it prescribed, it's probably going to work. you really should get them, but I would rather go start with the Omega Check blood test because it'll basically tell you how much of your whatever is the right kind of omega-6s instead of omega-3s. Start with
Okay.
that. And if you do need it, then yeah, you should go to an omega-3, but you probably want to get a prescribed version because I never know what's rancid or not. But the problem is if you're taking rancid stuff, you're just going to have higher LDL. But do I think those things have a major impact? Over time, eating a lot of fish, I think, would have a major positive impact.
Sure.
But
yeah, it's probably an easy, and then just for other factors, like we do need some of those EFAs for functionality. It's worth just having some regiment in there. Yeah, I'm a fan of the high EPA, high DHA. I usually try to get people to cover a little bit more than what's prescribed all the time. I don't see the problem of having a little bit more of controlling, having a little more healthy fats.
It's on, like I said, like I assume it's good, should be good as a supplement, but you never know.
Yeah. We did talk about a little bit through inserting maybe ezetimibe or statin if needed.
Yeah, those are high intensity levels of those statins. Those statins do work at smaller levels.
Yes. Yeah.
This is for the huge
I got a great results when I did need to use rosuvastatin at 10 milligrams.
Yeah, most start at 5 or 10.
It worked well for me. So we're going to skip past that one. Can we hit on this too, Josh? Can you give us like a little idea of what, because people aren't familiar with what they're looking at with ECGs.
The main thing to understand is you as a patient need to know what, if you're having palpitations, if you're having trouble breathing, if you're having any chest pain, that's generally abnormal and needs to be looked at medically. That's a red flag. Oh, my chest hurts suddenly.
So when we take a look at our blood panels and we see these numbers and we're trying to decipher our health and get an outline, an idea of our health, we're not really seeing the physical. We're not seeing the physical imaging on things. So to see abnormalities of like your LVH, being able to see a healthy heart versus your heart, which might be comparable or there might be a problem, getting imaging once a year is not easy to do. You could probably find your doctor if you talk to them and you have a good relationship with them. They should be able to order these, but there's also some cheaper alternatives starting to become available. Josh, when we were at the Arnold across from Justin's booth, I'm sorry, across from Chase's booth, they had an imaging company that was everywhere in the country, and I saved their flyer, I think for the hell of it, in the description.
What's their name?
Have like a stack
you're
of
putting
flyers.
the thing in there. Yeah, put that in there for sure. That sounds great.
Yeah, and they had, at least the Middle America had a few. There was some on the West Coast where you could get a little cheaper imaging, out of pocket cost. I'm going to see if I can find that for you, or I'll definitely look up the map.
Put that in the content for sure. I'll take it too. That's good.
Yeah, there was nothing New England wise. I think the closest was Connecticut, which wouldn't be bad for me. I'm looking at almost an hour and a half, 2-hour drive to go get something done once a year.
Which is completely worth it for you.
Yeah, absolutely.
Did you ever run an LPA test? The one that tests your arteries and your risk of cardiovascular disease? That's a good one. That is a good one to bring up because it's like medically recommended one time in your lifetime because you only need to know the one time. Basically, it's an LPA test instead of an ApoA or an ApoB. LPA basically tells you your genetic risk for heart disease, cardiovascular disease, failure, death, everything. No way to modify it, really.
Yeah,
because it's just really just a gene test. So that's why once in your life, and then I'm sure people are going to start playing with it and find ways to bring it down. But just because you bring the number down, guys, doesn't mean you've changed anything. So if you want to worry about your heart, get on your treadmill or get on your bike.
Is that an imaging, Josh, or is that something we can find in blood panel in the LPA?
LPA is a blood panel.
Okay.
Yeah.
Cool.
If you're going to start with something, if you're going to do your whole big baseline of everything with everybody, if you want to start with an LPA, and then you can tell people that aren't yet enhanced that, hey, based on your LPA, I don't think you should be enhanced or trying to go for enhanced.
I make notes for my video, and then I make notes for me. So this is going in for Dave.
Yeah, like I said, I know people can afford some things, some people can't afford other things, but I like to be able to basically give all my patients everything possible. So,
and what's LPA? That's not lipoprotein. What's that stand for?
No, it's lipoprotein.
What was it? I'm sorry.
It is lipoprotein.
Okay.
So the ApoB is apolipoprotein.
Oh yeah.
And ApoA is apolipoprotein A, and it's A is basically your HDL stuff, and B is going to be your LDL stuff. We do like ApoB as your better predictor of cardiovascular risk, but obviously ApoA.
Yeah.
We'll tell you about your
EPOA.
ability to heal.
And LPA is going to give me basically a genetic lipoprotein.
Right. LPA is a lifetime test, once in your lifetime. Tells you what your expected risk is. You'll like that one. That one.
I'm going to add that one, and you can help me look at that next time if you.
Yeah, I was going to say, you know what? I was thinking about it. I was going to get that one for myself, but I have this thing where I try to get blood work every month, so I'm trying to like hold off on it, but because my blood work was perfect last time I looked, which was last month. So
that's good. That's good.
Yeah, I'm on a health cycle phase, and I'm at 220, so we'll see how much weight I can lose as I try to get
I'm confident in you, dude. You're going to keep crushing it.
Yeah, like I said, I was going to say, I lost 18 pounds since the Arnold vacation achieved.
You sent me your cheat meal that night when we were in Ohio. I was proud of you. I was like, look at this guy.
What was it?
I have it on my phone. You had like desserts. You had a couple, I think I don't remember. It was one.
Oh, okay. That might have been the no hate shakes or the shake hates or whatever they're called. But yeah, they looked amazing.
I think you had donuts. We're gonna bring this up.
Oh, I ordered donuts because I was like, Blue would love if I ordered donuts, and the other thing I got was a chocolate glazed donut. I was like, all right, but I ordered the cream and everything, and I was like, all right.
Well, I'm gonna flip over. We're gonna show people Josh's order.
Oh, that's great. I said, I don't know if you guys know this, but I didn't remember sending Blue this message, nor do I remember much about the actual food I ate. I think there was probably a banana split in there. I'm usually a fan of those.
Josh, I go into that. Do you mind just giving us an idea of the difference between ECG and echocardiogram?
Echocardiogram is a picture of it. ECG. See, I always mess these up in myself. One of them is on your chest. EKGs.
Yeah. One's going to give us more of an image of the heart and give us an idea. So the echocardiogram here is going to give us a lot of kind of the imaging of the long-term things we'd be looking for as well. So that LVH is something you're going to hopefully be able to see quite well in an echocardiogram. And if you're checking this, again, like maybe yearly would be a great, not everybody's going to be able to do it yearly, but I would be checking that as well to see if you're contributing to your LVH at all. Let's see.
Like ejection, like the EF less than 50%, like you have heart failure.
Correct. Yeah, we want to. Whoa, I found it right here. Boom. Let me see. All right.
This is what I like about this. We have this very serious conversation about saving your lives, and it's like, check out this food Josh ate. I was like, all right. Because I don't remember eating food. I remember eating food, but not many times. Oh, the thing with Gonzo was fun. It was cool to see. I was like, man, he's really intense. He's like, yeah, I was on Anabar. I was like, bro.
Because Josh messaged me. This was Josh's 11 o'clock.
Yeah, that's legendary. Okay, now, yes.
Okay, so now we got. So first off, your fat ass went right for 2 desserts first.
Yeah.
I see the order that this was. Actually,
no.
You must have ordered
Canes was first. Then I was like, you know what, donuts might be good. Then I was like, what's that ice cream place? Yeah, I always talk to all the locals because what else am I gonna do? I'm gonna talk to everybody. I'm that guy. So what's the best ice cream? And he said Graders. I was like, I'll find it.
But what'd you do? So we have chicken fingers. What? You didn't just get a chicken finger?
See, Sam Sulik is like one of those guys I watch, and he always talks so much love about cane nights, this and canes and that. And
was it good?
It's fine. The sauce is what makes it. The canes is what makes it. The sauce makes it for sure.
Are you into the sauces too? I love trying sauces. I like barbecue anything. I like honey mustard anything.
I play with the mustards. I have a horseradish, a Dijon, and a Southwest mustard.
Now, do you do hot? Do you do hot stuff?
Hot.
Yeah. So
do I do hot stuff?
Yeah. Do you do buffalo? Is that as hot as you go, or are you a hot sauce guy ever?
I used to be hardcore on hot stuff. Like I would just get habanero better. I've had raw habaneros. I played with a lot of hot spicy stuff and played with a lot of Carolina Reaper stuff, actual Carolina Reapers. I just got bored with it. I do a lot of Asian food, which tends to be spicier, like Thai. Like
it's a different spicy.
Or Indian hot. Like I won't get the regular stuff. I probably should, but
they got a Thai place near us that's like super clean food. Like it's really bodybuilder friendly right near my house. But dude, when they put 1 pepper and they're like, yeah, this is only a 1 out of 5 hot, it's like a 20 out of 5 hot for me. And I can do hot. I don't know what it is about Thai food spices. Holy shit, man.
Different reactor.
Yeah. This is a good one.
Yeah, I tried to. Yeah, I don't remember exactly what I got from Graders, but it was definitely good. but it was so good and rich. I literally threw it away after. I think I got 2 pints, and I ate like the top little bit of each pint, and I was just like, that's too much.
You know me, I'm a donut guy. Would you go with donuts?
See, I tried to get I tried to get 3 donuts. I tried to get your donut, and then one that sounded good, like an eclair of some kind, and a regular chocolate glaze. Man, when you are in that situation and you open up your bag and you only have the chocolate glazed donut, you are very sad. You are sad.
They screwed you?
Oh, they didn't screw me. They were out of donuts. It was 10:30 at night. They're like, hey, asshole, we serve donuts at 5 a.m. I'm like, sorry.
Yeah, that's true.
That's another nice thing about the smaller towns. Most donut shops, there's already a guy working, and he'll just let you in and give you some donuts if you're hungry.
Yeah,
you have to buy them sometimes. They're usually there and they're cool. So that was always a fun thing I would do at donut shops. But
when I was a kid, when I worked at Dunkin' Donuts as a kid, the amount of donuts we would throw out at the end of the night was like a crime.
A trick for the cheap daters: lots of floral shops throw out their flowers.
Oh, you're a wise man. You know that I know you're gonna make fun of me for this, but I've been buying my wife flowers, cut flowers, for 15 fucking years, and if she's gone. So you'll get 2-3 weeks out of a good bouquet of cut flowers. And you got to think, I came from garden center background. I know everything there is to know about flowers for some stupid reason. But I would get bouquets, and she's literally, if I haven't spent $5,000 to $10,000 on fucking flowers in 15 years, I haven't spent a penny, dude.
More than that, way more than that.
But I enjoy it. It's
it's fun for you too, because you get to. I was gonna say, if you really want to save money, get her some Lego flowers.
Yeah, I got one time. Sorry, everybody, for us to go off topic, but whatever, deal with it. One time for, I think it was Valentine's, there was this place that had a rose, and it was like it's a cut rose. It's probably 18-inch long. It's like a large, fully developed rose, but what they do is they coat it with something, and they dip it in 24-karat silver or gold, and then it lasts forever. So it's cool. It comes in this felt box,
probably,
like a nice wooden box.
Dry freeze it, right? Or flash freeze it.
So something like that. They had to prep it somehow so they could dip it. But it's cool. Like, it's actually weighted, so if she needed to, she could actually trade it in for silver down the road. Like, it's cool.
I was gonna say, like, does she have anything like weird that she likes? Does she have Game of Thrones stuff? Is she someone that wants a suit of battle armor? Because that might be fun for you guys to do. Just get a battle armor and go places.
She's somewhat normal, believe it or not.
She's like you guys both homebodies.
Yeah, she likes her. She does what's it called? The plants, the terrariums. She likes building.
Oh, those are fun. Yeah, that's smart.
Thing. And she's got a business that she sells them.
Oh wow, yeah.
Let's see. All right, we'll get back to the trend. So we just want to encapsulate a few things. There was, what else were we missing? We talked about medical red flags was something we wanted to get into as well. Now, we've already hit on the mental aspects of red flags when it comes to the obvious stuff people we're going to talk about. Some people have had some kind of suicidal or deep, dark kind of thoughts on Tren. I'm not going to lie, it can be a little nasty mentally. Yeah. If you have experienced those things, it's not worth it. So I would just back off the gear, back off this, and just call it a day. Call it not for you. That's my true, honest opinion. There's a million ways to get the physique you're looking for through other means.
Yeah, I would say steroids work for a reason.
Yeah, but I don't think mental turmoil,
you don't have to
something worth it. Now, sleep disruption is very unique to Trenbolone. Any idea on why? Or is probably the whole fight or flight?
Fight or flight rev to the significant levels. You're generally warmer on Tren. Not sure if it's a uncoupling effect or if it's just more T3 or more active T3. That's something you have to go real deep into blood work with. But it just seems to be everything that testosterone does to you, but quite a bit stronger and quite a bit more dangerous.
Yeah, so we commonly hear with people, even on the lower dose things, when I say lower dose, let's just say over 100 milligrams, under 200. We'll call that a low dose cycle. That's the point where you're starting to run into sleep disruption from what most people deal with, from what I've seen as a coach for the years. Some people can handle a little higher, Josh, like yourself. Some people, you just sniff 150 milligrams a week and sleep's going to be altered and affected. So that's something.
There's going to be, like I said, compounding effects and progressive effects over time. What works one time may not work the next time, and maybe awful.
Sure. So that's to be expected. So if we're going to bear through a little bit of the sleep disruption, you're going to want to put some efforts into improving your sleep And it's going to be basic things like Josh did a great job outlining just some
Sleep hygiene.
non-pharmacological sleep hygiene exactly is what I was getting to. So that's the obvious stuff, what we can control. A cool, dark bedroom. This one is something people, for some reason, just don't understand the weight that it can play. Having an effort of continually putting yourself into a sleep schedule and fixed times for wake and sleep, it does work. Your body does eventually start to associate that nighttime routine. Using stuff like even blue light blockers can help the brain turn into starting to recognize the signaling. Okay, I got 45 minutes before I go to bed because the blue light blockers are on, the TV's gone off, some of the artificial noise and light around me has been dulled. Dark bedroom. So these are easy things that Josh put together that kind of work for sleep in general, not just Trenbolone specifically. But this would be a good start here, and then we can look into options of whether there's medical medicines that we can use or just things like melatonin. And I'm a huge fan of this one. I'm glad you put that in there, magnesium glycinate. And I do the same dose with most people to start, 400 to 600 depending on their size and their weight. That's a great one to help with sleep. Also, being an electrolyte, that's a benefit too. Also helps with bowel movements in the morning.
Yeah.
Kind of something I've noticed as well.
Magnesium and potassium dance together. So if you're messing with your electrolytes, magnesium is a good one to add.
Yep. I'm a fan of melatonin. Go ahead. I'm sorry, Josh. Go right ahead.
I was gonna say it's hard to read with that. You can get serum magnesium, but most of your magnesium's inside, just like your potassium. It's one of those things where a lot of times people just add that, and then they can sleep and they can poop better. And those are put on that list. Like melatonin is the most obvious one people use. People don't really think about that one. The ones after that are your medications.
Yeah, and be wary. Some people, 400 milligrams going to do the trick with magnesium. Start there. Don't be in a quick rush unless you want to shit your pants. Some people are sensitive to it. And
that brings up a good question, Dave.
Yeah,
if I told you could have the best leg days every time you went to leg day, but you were going to shit your pants, would you do it?
Oh yeah.
All right.
Not even thinking, of course.
Absolutely.
I'm gonna wear a diaper, and you guys are going to laugh at how I'm shitting my pants.
See, you know what? That's hilarious because I didn't even think about giving you the diaper out.
Yeah, I don't even need a diaper. I don't care.
All right. No diaper. Still do it.
I'm gonna have some fucking legs and stumps and some hogs, man. I could care.
No one's talking shit to Dave.
No, I'm throwing shit like a monkey.
That's awesome. But this is the type of person that becomes a pro bodybuilder. Yeah, I don't care for himself.
I like that you put this, Josh. There's a scenario where too much sleep disruption is just too much. Is that kind of what you're getting to here?
Yeah, if you're falling asleep while driving, that means you're gonna kill yourself or someone else.
Yeah, and then we already got like underlying issues a lot of guys are going to have, right? There's going to be sleep apnea probably
a lot of guys,
a lot of these dudes.
18 inch neck or bigger,
Yeah, and some of them are not going to be addressing it from the beginning, so you can't sleep. You got sleep apnea. You have no CPAP machine. You're not going to last long. You're not going to grow. Your body's going to reflect it in its look. So
well,
I'd
to
agree
be fair,
with you.
Tren is one of the few drugs that will ignore everything, including reality, and just work. So they might grow muscle without any sleep, but not as much as they could grow.
Sure, but you're going to pay for it. You're going to pay for it in the efforts to get there. But I'd also say that one thing Josh didn't put in here that's probably an obvious one right off the bat, so obvious, probably why we didn't put it, is just backing off dosage and seeing if there is a minimum effective dose you can still run and then catch your sleep back.
Yeah. Oh, that's what I'm saying. Like, guys are going to use this regardless. If it's too much at this level, then let's go down a little bit.
Sure.
And I think the guidelines on there are like under 200, over 200 to 400, 400 to 600. And we know people do more than that. So,
yeah.
That's mostly there for providers to understand exactly what's going on.
Yeah. Obvious other issues you're going to run across: night sweats. That's pretty common. And you actually looks like you have some remedies for this. I'm not aware.
There are medications that can work for the night sweats. Clonidine, like it's just little stuff like this. Different. They may work, may not. I haven't tried glycopyrrolate. I did try the clonidine patch. That one worked. And I actually tried aspirin, 300, 600 milligrams before bed. That worked as well. But I wouldn't do that every day anyway. I was just testing it that one time.
Yeah. That's a good one. So be wary of that. we've already gone through this, but what kind of mood and behavioral changes? I noticed exactly the same thing: increased aggression and irritability. Granted, a lot of that comes out a little stronger in a deficit prepping for a show versus off season. So there's a little mental ambiguity to think that your diet's going to play a role in how irritable you are, which is kind of obvious.
I was gonna say, I was gonna say this should be obvious to everyone. Yeah, man. Do you have clients who've never gone on a diet? That'd be great. So what
Right.
a great life, right?
So
No,
we'll
just stay
skip.
at 6% all year. Yeah, go ahead. Sorry.
I'm just going to say we'll skip through that. We'll let people read into that as well
And
as
then
some of the
basically, it's just like, hey, Trenbolone could mess you up so bad you get diabetes because of so much liver damage, things like that.
that too. Yep. Let's see. And we'll just flip through. I hit on everything that I wanted that we wrote on to the side, but what am I missing here, Josh, that we should take a quick peek at?
There's not really
mean,
much
you-
else to look
you were
at because
super
it's going to be a
thorough on
lot of.
everything.
It's very. I was gonna say it might be too repetitive, but it really you just need to have everything in there for every single step of the process. So
Yep.
you do it, but hopefully it becomes easy to use. Is what I was hoping for the providers, and there's medical codes in there for people that want to know what kind of stuff you'd have. The GI stuff that I don't have in there, it wouldn't be very in depth. It would just be your basic. Start with what is it, Miralax, and then go to stimulants later if necessary. There's not too much, but it's just what we do. There's a lot of PPI recommendations for a lot of medical guides. I don't like PPIs. They basically over time become a real problem, and most providers don't stop them after 90 days like they're supposed to. And some of those are over the counter, like omeprazole. People don't realize, you probably shouldn't take more than, I think, 4 doses of those.
And then there's also Trenbolone is going to uniquely give you a little bit of a sensation of heartburn and acid reflux. That's very
that can
common.
happen. Right, yeah. I've seen famotidine work for that one. I've also seen cetirizine work for that one. It seems to be that if you take steroids, you get a histamine response, of course.
Mhm.
And if you stack histamine blockers, H2s, like your cetirizines, levocetirizine, over-the-counter stuff, you tend to have less problems.
Okay, that's a good one. Yeah, I see a lot of people go right to the PPIs, and I would probably advise against that.
If it's just food related, then I would go to a calcium calcium like we would at Tums. But if it's food and steroid related, then that's when I'd probably move up to the histamine problem.
Anything worth, let's actually, before I give you my last question, let's rapid fire these red flags. So we're looking at keeping an eye on HDL, making sure that's not too much at a critical low point, and how to address that. Blood viscosity metrics, obviously checking those. That's going to be part of anything that you're going to be doing, even if you're running Trenbolone anyways. Hopefully people are paying attention to this as well. Josh talked about the ACR score.
Yeah, I would say big thing is if you see something that says urgent nephrology, urgent phlebotomy, et cetera, that means a actual cardiologist, an actual nephrologist needs to be working on this because it's past the general provider's level. Now, the stuff they do is in the guide as well, of course, but it's not something you want to manage by yourself. You definitely need to supervision. Let's see the biggest ones. Obviously, if you guys don't know what rhabdo is, that's where you're peeing Coca-Cola. That's to go to the hospital because you're dying. Call 911.
Yeah, you're gonna feel that one too. Obviously, checking our filtration.
Have you ever had it or seen anybody around you?
No, I had a girl that had it one time when she first started working with us, but we picked up on it. She had it walking into the scenario with us.
Yeah.
It was pretty obvious actually, and she was already hinting towards that's what she thought it was.
Yeah.
That was an easy fix, basically being able to just get a baseline of blood work with her when she went with us, and then going into really
that's
just
kind
kind
of
of
a good save.
a good resting period too. So that's a good one. Checking creatinine levels in the
and they're in medical terms. It's like myocardial injury instead of heart attack, and it's hypertensive emergency.
Yeah, for blood pressures.
Yeah, but basically, your cardiovascular system is everything. If you have a stroke in your brain, it's because your cardiovascular system fucked up.
Yeah. Dark urine, rhabdo, keeping an eye on that. That might be a little unique too, because
that's more what I expect with bodybuilders and people who are doing their big water drop stuff.
Yes.
Water pool. Yeah.
Severe headache and vision changes. That's a good one. Yep. Keeping an eye out for that. So this gives people, that's a good little list for those.
And here's reasons to never use Tren. If you go down, keep going. No, keep going down. Absolute contraindications. Ta-da. So if you have arrhythmia, please don't take steroids. If you can't control your blood pressure, please don't take steroids. Kidney disease that bad? No. Diabetes is really a bad one because diabetes is it's one of the big of your top 4 killers, it tends to lead to all 4 of those.
Yep. So there's a good list of that. What the hell was it I was going to ask you too? It'll come back to me.
That's all right.
All right. And then let's see, sample order for blood paneling. Yeah, this we don't have to go. We went over this 3 different ways.
Yeah, it's different. Yeah, different stuff. Yep.
Let's just keep flipping through.
There's a questionnaire for your stuff, how to rate everything.
This is your mental health?
Yeah, Appendix A.
Okay.
Depression screener, I think anxiety screener.
Is this common in medical literature? I'm not.
It's common in. Okay, so I do a lot of assessments for people. So it's common baseline assessments, and this is going to be just your baseline stuff. This isn't going deep into the psych field. But it's just how do you feel? Yeah. You know, because like,
is there like an average score you're looking to stay above or below?
It should be at the bottom. It's one of those things like when there's so many charts and graphs to remember, you just look it up as a nurse.
Oh, okay. So you have it's broken down into. Okay, I have seen these before.
Yeah, because I'll have like different ones I have to do, like MMEs and all these other fun ones, and it's just
okay. Cool.
Yeah.
This is great, dude. Now, Josh, you're hopefully going to make this available to some people if they want this as well. Is that the goal? Or
the goal is this is the rough draft. I need to get a lot of feedback from everybody I want. I'm going to do a talk with Austin Parabolic about it. I've sent him the stuff. Oh, that's a funny story. Apparently, I trolled bodybuilding with Aaron so hard he got upset on one of the H4M streams. I'm trying to find that video. It was bodybuilding with Aaron, Austin, and I think Mike Horner was on it with him, but I can't find the H4M video. But I was just like, I thought he was in on the joke. Apparently, he wasn't in on the joke, and I trolled him pretty good. I'm like, dang, that sucks. It's like of my bodybuilders, like of the bodybuilders I know of and don't know, like he's one of the ones I actually would like to know. Because he like looks like
I don't know Aaron too. I don't know Aaron too well. Just I've been on a few shows with him. That's actually funny. I was just on Parabolic last night.
Yeah.
Oh yeah,
Eric,
live.
Yeah, I've seen it. Yeah. Eric was. Yeah, I think I was on. I talked a little bit, but yeah, I had to work all day. Yeah, Eric was looking for people to come on the show, and he messaged me. I was like, yeah, sure. But no, Austin was like, "Are you Joshua Perry?" I was like, "Yeah." The Joshua Perry that trolled bodybuilder there. I was like, I thought he was in on the joke, but so tell me what happened. So now I really want to see that video, and I hope I can find it.
Yeah, Ryan, I'll see it whenever you guys put it up. All right, cool. Let me bounce back out of this. Josh, this is pretty dope the way you put this together, man. I think this is going to be helpful.
Big help from Perplexity and other providers, of course.
Yep.
Because I mean, you got to have sources for stuff like this. You can't just be, this is mine inside my head.
Yeah. The nice idea of what you put together here is it just kind of lays things out in a much more organized fashion, because a lot of this is not super new to how we would be in our heads approaching risk management and useful management of just mitigating through side effects. But when you have it out in front of you and you have these things ranked and to get a better understanding of why we're looking at these things uniquely for Tren, it's going to help people hopefully be a bit more responsible in their usage, where they're not running across problems that we know how to avoid from the start. And a lot of the lessons you and I and all of us have probably learned in this realm is through our mistakes, and a lot of also on top of that kind of intentional experimenting with our own bodies.
The first step to being good at something is failing at it.
Yeah, no, it's totally true. You learn a lot from it. My uncle used to say you learn from time, money, or embarrassment. Just hopefully you don't have to pay all 3 at once.
Yeah,
it's super true. You can, and I guess I'd put this into the time and embarrassment factor of I've made a lot of these mistakes that we're talking about, dude. I've introduced Tren and run my blood pressure up. I've used Tren as a kid and had horrible diets, thinking that I could get away with it because Tren's some magical nutrient partitioner, which it's not. He does a great job at that, but it's not a miracle.
I'm not going to compliment Tren on this video as much as I desire to. But I was going to say the embarrassment thing I was thinking about, I was like, oh, because if I just got on stage right now, I would embarrass myself and definitely stick to my diet. Do I do that? Could I do that?
We want to stick to our diets, yeah. So a lot of these, the cool thing is I like that you put this together. I thought it was worth a video just showing people
I'm glad you be a lot more. I want to talk to everybody about it because it's
and even for the experienced guy, you taught me a few things I wasn't a little aware of when we looked at the what was it, the LPA is something I'm going to get an idea of and get that tested myself. ACR is something I'm not super familiar with, to be honest. And the way you use albumin and just using that is also like another metric to back up some of the things we're looking at when it comes to.
Yeah, and for the urinary ACR, if you can't get that one, because a lot of these places don't have it for some reason, but I know you can get it at Walk-In Labs as one of those alternate sites, and you could probably order it directly from LabCorp or Quest or whatever. The big thing I've noticed about the past couple of years of watching this idea of a safer use model is we don't really have a model.
Sure.
Like, we have ideas that should be built into a model maybe, but we don't really have a model. So we need to figure out what the model of safer use is. And I think safest use is obviously TRT, but safer use would be starting with just going test and AIs up and GH only up. And then if you really want to introduce those exotic compounds, then here's your next problems that you can address. So I'll have an EQ guide eventually. I'll have a standard steroid guide eventually. But I want to see how the Trenbolone one looked at. And if people want to interact and correspond with that, we'll do that. But if there's no interest or no usage, then I'll just finish what I have and just put it out and not worry about the EQ or the Nandrolone or the standard.
I think I'd like to find a way you and I can put together a short as well and circulate that. And maybe this can drive people to maybe ask you about it, get some of the feedback you're looking for it.
So I can tell you what to say. I love steroids. You love steroids. This is how we medical professionals should address your steroid use. Here's the medical red flags and flash those up. And then there you go.
So when we go to Ultra Labs, is this, so I typed in ACR, albumin, creatinine.
Try it, just albumin, see if you can find it, and try creatinine and see if you can find it. Because I found it on Walk-In Labs. I haven't seen it on Ulta, but Mike orders from somewhere and he's got Quest Labs for it. So I think he has Ulta.
And what is it? Albumin timed urine test?
It's like albumin. It's like an albumin creatinine test. So it should tell you how much albumin creatinine is in your test. Because it's basically your albumin creatine ratio. I think they have it. If I find it, I will send that link over.
I thought I already had it, actually. I thought it was right there. Let me see the ACR and albumin creatinine ratio.
Yeah.
Let's just take
a
look.
There we go. There should be some cheap ones, I remember. Albumin time urine test, yeah.
So this is what's covered in those 6 biomarkers for the ACR timed urine test. And then we have, what do we get in this?
Yeah. Some of these should work. Albumin creatine ratio timed urine, which is probably more than you need. Random urine is probably going to be okay. Because it should give you your ACRs. And you can use 24. Yeah. Like I said, I'm not sure which one Ulta wants you to use.
Okay.
But your main thing is you want to figure out what does it tell you your albumin level into your.
We could pull our albumin off of our CBC.
That's on your. That's the albumin in your blood. Okay, the albumin in your blood is related to the albumin that shows up in urine, but the albumin showing up in your urine, you have problems.
Okay.
Yeah, because the albumin is like a binding agent for proteins. It just holds on to various things for you. So it also sits inside of your kidneys vessels and basically was a positive negative gradient and keeps your protein from leaking through. Eventually, the holes in your kidneys that let stuff through get too big, and then albumin starts coming through, and then that starts pushing bigger and bigger holes. Suddenly, you need dialysis.
What LPA? Should I just be putting in LPA, or is that different?
It's just LPA. It might be LPA too, but I think it's just LPA. Let me check it.
See, I don't see it here. I'll find that and try to get some links in the below for people to see the specific, if they want to pull those, add those specific labs. So I'll dig into that after. It's not popping up right for us right off the bat.
Yeah, those things are sometimes unwieldy, but there's so many things to order medically. Like a calcitonin. Are they going to die of this disease? Oh boy. Not this disease.
Was I even sharing the screen for you to see earlier?
I didn't see anything as you were putting out, no.
Oh, okay.
We'll fix it in editing.
Yes, not a problem. So this was that ACR I was looking for.
Yeah, that's probably it. But I was saying, like on my screen, it doesn't show up very well because I'm on a 30-inch monitor. But as long as you're getting your albumin, it should have a number in there, and you can probably look around. But that's another thing I might want to look into, like adding links to the various sites to do your blood tests. Because but it's one of those things.
I'm working on like a categorized. I'm going to make carts for people to just check things so they don't have to look.
Yeah, that's way better. That's so good. Yeah, that's a great.
Yeah, that's my plan, is to have a little list that people can access down the road. That's on my list of shit to do for everybody here. But that's cool. Good. Anything else we should probably add, Josh, that we're not hitting on when it comes to our Trenbolone talk here? We've
up
gone
the
over
trend. Safely.
Up the trend. What do you think about, I don't want to I don't want to really get too into dosing with people, but
Mhm.
do you think you could categorize low to mid-grade to like high
Yeah,
tren use? I
I
think it's
I
a
was
number that's just
if you're
so
gonna
fluctuating.
yeah. If you're gonna do Tren, you probably want to start with the lowest dose possible.
Yeah,
The
and I'd
medical
probably
dose
say maybe
was like
10 milligrams a
10
day
milligrams a
would
day,
be
right?
a fair assessment
Yeah,
of low.
that was
Of
another
low
thing.
is
I
low.
also prefer daily shots for Tren Ace to
Sure.
test your response. You might have a different
Yeah.
response for Tren E, but the problem with Tren E and Tren Hex is if you've taken too much.
It's long acting. Yeah. So it's going to take a while. So that's worth mentioning to the newbies that don't understand the difference between ACE and enanthates and some of the hex options with
Right.
Trenbolone.
More just means more. And it could be more you don't want, or it could be more you do.
So if we're going to put in a compound, and this kind of floats with most compounds, right? Like we could probably say this is a wise introduction with NPP in the nandrolones would be
the thing
picking
is,
your
like,
fast-acting compound first. So if you do arise to a problem or something's not agreeing or dosage is off, you can quickly pull it out and let it clear the body faster than we would with the enanthates, the cypionate line.
with one caveat, our 19 nors, our Trenbolones, our nandrolones are not as well metabolized out of the body. So you'll get them lower, but they're still going to be inside.
Sure.
You know what I mean?
Yeah. And the magic is being able to pull it in and out quickly is what we're going for with those selections. So that's worth mentioning to people as well. And yeah, I'd say a starting dose again. It all depends, but in my
what
book,
I expect people to use is to start with 200 milligrams a week or 400 milligrams a week or 600 milligrams a week and have a terrible time. But if you're a bodybuilder who's doing this wisely, you're going to do daily shots and you're going to start with your 10 and see what your 10 does to your body. And I think coaches, what do you guys, every week you get a new shot and every 2 weeks you get a new shot and you're looking at what do I want to change, this, that, and the other. Tren's so strong, you probably don't have to change anything, I would guess. And then it just works itself through people really great at, even at the 10.
Yeah. And that's a good starting spot where you're going to notice effects and hopefully just skating underneath the side effects.
Yeah, you don't want to feel Tren.
Yes.
You don't want to feel a hormone, generally speaking.
Yeah, that usually is an indicator of too much or too aggressive or you're sensitive to it. Yeah. Hopefully this helps everybody. We're going to hop off now, but I'm going to put all of our information here in the description below. We'll put Josh's information so you guys can reach out if you have some questions with him, and hopefully Josh will add to this guide, the practitioner's guide of Trenbolone.
Yeah, let me say it out real quick. Joshua Kevin Perry at protonmail.com. Everything will be anonymous unless you ask me for explicit accreditation.
Exactly. Good. Yeah, and then you guys can reach out. Josh will be looking for a little bit of people's experience with the compounds themselves and some information that he can use to contribute to this and just make it even better for people to have as a guide to just hopefully get some responsible use out of their Trenbolone. And I don't want to sound like a negative Nancy all the time picking on Tren. I think there's a use for it, but today's culture, in today's steroid usage, we see commonly across the board with everybody is they try first, worry later. And I'd like to give people a little bit of insight ahead of time. And I think this is something that Josh has done to just say, hey, what to look for, what to expect, and what things you're probably not going to avoid. There's some of the things that you've mentioned in here. Everyone's going to experience with Trenbolone to a point that we want to be wary of. So this is just a great way of saying, don't make the mistakes we have. Take our wisdom and our knowledge and our mistakes and use them to your advantage.
Make my stupidity help you.
Exactly. And in the comments below, tell us what we missed. Tell us any questions that you guys have, how we can further help you with your experimentation, and we'll go from there. So appreciate all of you watching, and until the next one, everybody be good and grip it and rip it.